This is the first time I've had a sweater on for quite some time. I live in Florida and we're still in the 90s. When I got out, I was telling Al a few minutes ago, when I got out of the hotel this morning, I quickly retreated to find my trusty sweater that I keep in my bag all year round. Good thing for that, because I didn't remember to bring anything. But it feels good. It feels very fall here, which is very nice. There's a whole lot of things that we could talk about. Resilience is hot, so I was struggling for what would be helpful. So, what I think I'd like to do is this. I'd like to just make a few comments about a few things and then leave it open to you to talk about. You tell me what you would like me to talk about or talk with you about. How about that? You can kind of directly tell me what is of interest or concern to you. What about home life? What about home and center life? What about those episodes that I bet you that's not the only time you experienced those?
So much.
Yeah,
That's my improvement.
you got two children out there trying to manage, and one of them is just not about to come in without some assistance. And and you cautioned me that she could be a little self-injurious, and I just kept going. What I wanted to say was, but it wasn't time to say it was. I've been down that road so many times that doesn't concern me a little bit. I'm used to it all the time. But anyway, so what we got her in.
We got her in.
We got her in. So that was important. We got her in. And she was happier, I think, once she got it all the way in. She was happier in the end.
She was.
Didn't want to go in.
She wanted her way.
Oh,
But
yeah.
at the end of the day, she was happy where she was.
Oh, yeah. I spent my whole adult life working with people with developmental disabilities, trying to teach them that you can't always get what you want. Those of us who are old enough to remember this, remember that was a lyric out of an old Rolling Stones song. Remember that? Yeah, you can't always get what you want. Well, one of the things that has always struck me as important in working with children and adults with developmental disabilities, autism included, is the importance of parents in the program itself. The best outcomes that we get with kids and young adults is when parents are part of what happens. Because if they aren't, or they're limited, then a child learns to behave one way in front of some people and another way in front of other people. Now, what you hope is that when you teach a child to behave or to exhibit skills in front of a particular person, those skills will generalize effectively across other people. And sometimes that does happen, but sometimes it does not. And those children who have more limited repertoires, it tends to happen less often than those children that have more extensive skill repertoires. Okay? So a child with a limited repertoire would be a child that some people, and I don't like this expression, would be a little lower functioning. I'm not fond of that expression. I'd rather say in a more respectful way, a more limited repertoire, as opposed to someone who has a more extensive repertoire, might be academic and that sort of thing. Okay? Now, again, the people with more limited repertoires. Now, we don't understand why this is the case. Science has never given us an indication yet as to why this happens. But it's pretty obvious if you have a lot of experience that people with more limited repertoires tend to experience less generalization. In other words, what tends to happen is this. They tend to learn mostly exactly what you teach them, and not what you don't. And they tend to exhibit it in the circumstances in which they were taught it, and not in those in which they weren't. So that means they tend to behave in certain ways around, in certain adults, in certain environments. See what I mean? And what doesn't tend to happen is you don't tend to go, wow, look at him doing that. I never taught that. I don't ever remember teaching that. See? Now sometimes that does happen. Of course it does. It happens with most children. It tends to happen more often with children with more extensive repertoires. And again, we don't know why that's the case, but it pretty clearly is. That makes sense? So the advantage of having parents involved in what you're doing as a therapist is to get that generalization to happen. In other words, you could teach a person to do certain things, and then they don't move over environments. Example, you're teaching somebody to use signs in communication, let's say. Where you'd have to recognize the sign that the person's doing. Right? Well, children are going to respond to the people that recognize the sign, the people that know what it means. They acknowledge it. They're not always going to get a cookie if they ask for one, nor should they. They should learn to accept no like any other child would. But people, the children will respond to people that have a history of knowing what that sign is and what it means. And that's a pretty obvious example. But even simple things like this. You're out in public, you know, and you're doing errands. And you say to your child, hold my hand. And sometimes they do, and sometimes they just as soon run the other way. You know? Okay. Well, no, he does it for the therapist. You ever heard that? Yeah. Does it for the therapist. Well, that's nice. But the therapist isn't with you at the cleaners. The therapist doesn't go out to dinner with you. You know? And so, what's important is that when you say, hold my hand, that child will hold you. Because that's dangerous if it doesn't. And you know the little one. You ever had, when you try to do it the first time, you say, hold my hand. So you take your hand and you hold on to theirs, and they stick their hand completely out like this. So really all they're doing is tolerating you holding their hand. They're not holding yours. True? And some people will take that. Well, that's good enough. No, it's not. We just finished writing a curriculum. It took us 4.5 years to write, essential for living. And in hold my hand, we define exactly what it is. If you don't wrap your fingers around the other person's hand, you're not holding it. And don't accept anything less than that. Now, what if a therapist insisted on that? And that somehow didn't get communicated to mom and dad, and they took the other. See where that's going? See where that's going? Now it's a simple little thing, but it'll make a difference. Whether your child, you blink, you turn around, and your child bolts away from you. And then it just scares the living daylights out of you. If that happens in public. Or your child unfastens their seatbelt when you're driving 45 miles an hour down the road, and your child just undoes their seatbelt, and it scares the living what out of you. It really just frightens you to death. And those are very common experiences. They are. And so, when I say put your seatbelt on, you put your seatbelt on. Sometimes what people will do is, who taught that, they'll say, see, if he does it in front of me, and they take it like it's a badge of courage, right? Sure. Or some kind of like, well, he does it around me. Sometimes you'll hear a teacher say this. The ultimate test is not whether they do it in front of the person who taught it. The ultimate test is, do they do it in front of people who weren't the original teachers, who weren't the folks that got it started. Because most of the time, or many times, the person who taught it to you the first time, there are many more people who will expect it to happen. Who will expect it to happen. And that's it's just critical. So, it'll go both directions. Sometimes, you will teach something at home which the Baka staff has not taught. Or at least you don't think they have. It has never come up in conversation. But you have. They should know that. Because it should transfer from you to them. They should know that. So tell them, seriously, don't hesitate. Tell them. I know Carl and his staff will want to know that. I would want to know that. I wouldn't want to be out of the loop on that. I want to know that. Because I want to make sure I did that too. See? And it goes the other direction. See? Then you want to be in the loop in the other direction. See, what are you expecting my child to do? Okay, well, I want to be on that. I want to be on that too. Because what good does it do to do all of this, only to find out the child only does it one place, does it half-heartedly, you know? And not because people don't mean well, because they do. If meaning well was what really mattered, this would be an easy job, but it's not. My professor used to say, intention is a great thing, but it doesn't take you very far down the block. It's a good thing to start with, but it doesn't get you very far down the block. You gotta be involved and have skills to do it. And one of the things today that's permeated parenting in general, and then I'm gonna stop talking and let you guys do the rest of this, is I've watched this happen 44 years now, and doing this. And people will ask their child, they'll say, hold my hand, or stand next to me. The child doesn't do it. They repeat it again, stand next to me. The child doesn't do it. You see this in public, you see it, stand next to me, child runs off. Stand next to me. Doesn't follow it up. See? You know, children learn what we mean and what we don't. Not by what we say, but what we do. The reason I offer to help you out there is because you only got 2 hands here. You were like, that bulb's never going to get in the front door. And the way she was going. But it's more ideal for you to do it than for me. But that doesn't mean occasionally people don't need help, because we all need help, and we all need to be pitching together and help, and that's what we're all about. But ultimately, she needs to respond to you like that, and that's what we practice until it happens. When you say, come over here, we're going, we want her to go. Not put up a fight every time, not put up a fuss every time. No, no, we're going now. I know you don't want to. Guess what? That's part of life. You're not going to like everything. You're not going to want everything. You watch parents today trying to be friends with their children. It's as if they are. They want, and then they're mistakenly told by a lot of people that you should keep it positive all the time. What is positive about accepting no for an answer? Nothing will ever make that a pleasant experience. You go into your favorite ice cream shop and they're out of Jamocha almond fudge. They say they're out of that. Oh, that's disappointing. I came here for that. Well, you don't walk up to the guy and say, gee, thank you for not having Jamocha almond fudge. That was a great experience not having it. No, of course not. It was very disappointing. You were looking forward to it. You had something that for dinner that left a bad taste in your mouth, and you're saying, boy, I want that Jamocha almond fudge. That'll make my life better tonight. Not there. Well, you got to get on. And so people think, everything's got to be positive. No, it doesn't. It can't be. There's no way it physically can be. And you wouldn't want it to be anyway. Because if there's no contrast between the unpleasant things to happen to you and the pleasant ones, you don't enjoy the pleasant ones. If every bit of food you had were average, you wouldn't want that. Occasionally, you find something that's really not so good. So you avoid that place, and you go to the place that has better food, and you appreciate the better food. Why? Because some of it's not. That's how you learn to appreciate stuff, and that's how kids do too. And so, be worried about if everything's positive. Everything's not going to be positive. You wouldn't even want it to be. You wouldn't want it to be. And a lot of it is this, I want my way. Yeah, I know you do. Guess what? Not going to happen. And what was I saying to your daughter? See? I understand you don't want to go. We're going. I understand you don't want to go. We're following Mom. We can do it. I understand. But we're following Mom. See? What I could have done is I could have sort of been, well, I'm sorry you're not feeling so well, and I'm sorry all of this. And, oh, no. Mom gave her the direction, come in with me. So what I'm going to do is, we're going. I understand you don't like it. That's not the issue. We're not sitting here deciding what kind of ice cream you want. Then it would be an issue. But we're not. We're following Mom's direction. That's what we're doing. So guess what? I'm going to stay here until we do. Because that's what we're about. Nothing else matters right now until Mom's direction gets followed. Except safety, I know. Anything that might. Other than that, nothing else matters. Because when I tell you to do something, I mean it. And I'm not a big meanie. I don't think I was mean, soundly, was I? No, I'm not mean. I'm just persistent. I tell you to do something, I'm staying there until you do. Because I want you to understand that when people give you a direction, that's what's going to happen. And you fuss and protest, but that doesn't get the direction to go away. It stays right there. Because your behavior will not get me to go away. I'll stay. I'll stay till it's done. See? And that's one of the hardest things, and that's what you don't see a lot of times in public. You don't see that in parenting in public. You don't see people who, when they say something, when the child won't sit down in the booth in a restaurant, they don't go get them and put them there if they have to go. They try to coax them. Come on, you're going to like it better. Oh, come on now. And then some parents will resort to, please, you ever heard? They start begging their kids to behave. Pleading with them to behave. No. I find young behavior analysts, people in my own field, doing the same thing. Or trying to give them a reason why you asked them to do it in the beginning. If they have language of, oh, why? I don't want to do it. Why? Wait a minute. Mom said, go into the building with her. There's no whys about that. Why are we doing that? Mom said we're doing it. And she's your mom. And you're a kid and you're not an adult. You follow what your mom tells you to do. In you go. That's it. There's no whys about it. People explain the reasons. All right, so there's my little pet peeve for the night about parenting. And is that easy to do? Oh, no. No, it's awful. It's horrible. It's unpleasant as it can be. But if you don't do it, things get worse. They get worse. They get a lot worse. And then your youngster gets to be almost as big as you. And it won't even take that long to get there. All they got to do is get about half as big as you. And it'll say, what do you say? We're going in. I'm not going to argue. I'm not going to fight. But I'm going to stay here until you go. And that's the end of it. Well, that's the end of it. You know, and doesn't that be mean? Doesn't that be nasty? Doesn't that be anything? Just persistent. Just say it. All right, now, how else, and then the whole notion of parent involvement, how else would you like me to direct what we talk about? Let's give you thoughts or suggestions or anything. Anything at all, doesn't matter. If it's something I can't talk about or don't know anything about, I'll tell you. And that might very well happen. Anything about language? Anything about difficult behavioral situations? Yes,
Hypothetically, let's say there's a large 10-year-old child in the back seat, and he kept having a conversation with his mother about, well, the person poked into me as I'm walking downstairs to the car from the mall, and he goes on and on, and the mother says, okay, you can stop now, this is enough. And then he gets mad and says, well, what if they try to kill me? And just starts really just kicking off on another conversation. And let's say his diagnosis is Asperger's.
Good. I could have bet you were headed there. Yeah, okay. All right, here's what we'll do. First off, when he starts the conversation, if you think it's a conversation that would be productive for you to engage in other words, you really need to know what happened or something, and that's important for safety, then you would engage in that conversation just like you would with anybody else, because if now it is moved from I need important information to we're obsessing about this, when it's clear that's where it's moved. Does that make sense? When it starts being repetitive and obsessing and you've already said that stuff and I understand what's up, we're done now, that's enough. Then, no, we're done with this. This topic is over. Okay? And then, if the child is in the car and they get out of their seatbelt and it becomes dangerous, you pull over as soon as you can, you go sit in the back seat with the youngster and say, I'm sitting here till this is done. or whatever you need to do. We're not going to go anywhere. We're not going to do anything till this is done. Amen? Or if you're not in the car, you're somewhere else, same thing. You and I aren't going to have another conversation till this one's over. And wait 'em out. And it could take you 20, 30, 40 minutes. Maybe longer. But what happens is if you get back into that conversation when someone's obsessing, what happens? You said to the other person, this is a conversation he wants to have, when you didn't want to have it. Does that make sense? Because you're engaged in it. Other than to say, we're done. Most people will find that pretty aversive. I mean, if I did that with you and said, we're done, you'd think, God, he's obnoxious. You know, they don't like that. They go, like that. That's not fun. Well, we're done with this conversation. Now stop. And I'm going to stay, I'm going to keep that position until you stop. And then, if I manage to get you to calm down and 1 minute later you're back at it again, I'm right back there. Does that take enormous patience? Yes, it does. Is there another easier way to do it? No, not much. There is, but you'd like that even less. I mean, the other way would be involve some sort of punitive procedure, which a lot of people wouldn't like either. So this one is like, we're not doing that. No, we're not. I've had kids do that, and then they'll stop for a little while, and then they'll try to sneak back into that same obsession by rewording it a little bit different. You've probably been there. Oh yeah, now we're going to reword the situation just a little bit. Well, that's no different than typical teenagers who make a request, no, 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 no. And then they'll come back and try to schmooze you. Remember those dishes I helped you with? And can we go to the... we were done with the movies. We're done with that topic. No, you're not going out with 3 girls and you're 13 years old to go to the movies by yourself. No, you're not doing that. Teenagers will do the same kind of thing. They'll just kind of schmooze in and get her... No, I can see that coming a mile away. We're not going there. It's tough. It's seriously tough. But people, it's like anything else. If you can kind of feed into it accidentally without meaning to, you could go back and just say things like, now you remember we had this conversation about that, and we decided we weren't going to talk about it. That's already too much interaction, probably. It's already too much. They got you back into that whole drift. We're done. And boy, will the youngster probably hate that. Yeah, guess what? You want them to hate that. I'll bet you do. You want them to hate that so they won't do it anymore. There are certain things in life it's okay to hate. Really. Seriously, it's okay to really seriously dislike. You know? Yeah. Makes it easier for you. You know what things to avoid. Really. You just stop. You just... There's certain people on television. I see them and I'm turning the channel immediately. I don't want to even listen. I'm done with that. You know? Really. See somebody. Or somebody's in a movie or something. I'm done with that person. I'm done. On the other hand, there's people I see and I want to listen to them, or I want, and then I'm going to keep them on. Same thing. Just going to say, I'm staying here till you stop. And I'm going to show you. No interaction.
Poop training.
Say it again.
Poop training, potty training.
Yes.
After it became a power struggle, and they would basically hold it for days.
Yep.
And can't position them into a perfect position to allow the body to do its thing. Any advice?
Enema. No. And I'm not being a smart aleck. There are certain things in life that the children can have a little more control over than we can. And I've seen young people like that get impacted, and it's terrible. It just gets, it's nasty, and they can do it for days and days and days and days and days. That's when I think you have to talk to your physician, because, see, it's a little bit out of your control there. You can't make that happen.
But I've got no answers from the doctor.
I'd go talk to your pediatrician, I think. I don't know. What do you think about that? Would that be reasonable? I think I'd talk to my pediatrician. I absolutely would.
Then they're done that.
How about is there a developmental pediatrician you could talk to?
Or a GI specialist.
GI.
Or a GI, or a GI person, that's what I would do, because get a referral to another, because,
And then they're.
I think you can't, well, I don't know what to say, except if you just keep looking, because I think that there are just certain things you can't prompt, you can't, I mean, you can do a little bit with the diet, certain things are apt to make that a little more likely to happen, but again, boy, I know some kids that you could give them the right kind of food and it still wouldn't happen. And they could go for days and days and days. And oh man, and little kids get impacted and that's uncomfortable for them. And then they have to have it taken care of. That's the whole thing's nasty. But there's just certain things like that sleep is a bit like that too. Sleep can be a bit like that too, because you can't force or prompt sleep to happen sometimes either. And that's where you need often a little bit of help too, because it's, you can't, it's like if I say to you, hand me the cup, and you don't do it, I can take your hand, grab the cup together, and I can make it happen, and then I can fade my hand over hand. But I can make that happen. But pooping, I can't make that happen. I can do things that I think I make it more likely for it to happen. But the bottom line is, you really don't want to, it ain't gonna happen. And the same thing with sleep. Sometimes. Well, I can't control all of that. Sure, I can keep you really active and all that sort of stuff, but then I've known some kids, you can make them active and they'll 2 hours of sleep a night. Well, they could survive quite easily on that. And so you sometimes need a little help with that kind of thing, because you can't, even with everything that's at your disposal as a parent, as a behavior analyst, it isn't enough. It's not enough. Just like when I have really severely self-injurious or aggressive kids, do I sometimes look to my colleagues in the medical field for a little help to get going with some stuff? Yeah. Do I think that I want to see them medicated indefinitely? No, not at all. But I don't want them to hurt themselves either. And I know that I can't control every aspect of what goes on. So while I'm trying to learn how to control as many aspects as I can, I want a little bit of help, I'll welcome some help, you betcha. And if I didn't have it, I'd be at a tremendous disadvantage. And I don't want to medicate a youngster for behavior. I certainly would not want to do that. But if I had a personal belief that you never did that, then there'd be a whole lot of kids in the world I couldn't see. And I couldn't possibly be effective with if I held that personal belief. I wouldn't be able to see a lot of kids because it'd be too difficult. You try to change whatever you can given the environment. But when you don't have control over certain things, it becomes difficult. And sometimes you don't. You just don't have control over certain things.
Well, we're not 1,000% sure if he can feel it, but the only test if he can feel it and medically do it, he has to respond on command, and he can't do that.
Yeah. Well, there's one condition you would know it by the condition, but he doesn't have that condition, or you'd know it. But so there's a couple conditions with which that's associated all the time. I'll find a bit, and you would know. But in the absence of a condition like that, you wouldn't probably know.
He's got a genetic condition that is unnamed,
Yeah.
so.
Yeah, and it's it's amazing how some of the children, what they will look to do to control the circumstances in their life. It's pretty amazing what they will go to, some of the kids. It's just such extraordinary. People that would bite themselves and kick and hit and scream. Imagine kids that rectal dig. Oh my goodness, what would get you to do a thing like that? What would get you to stick your finger in your rectum? What would get you to do that? What would get you to ruminate? What would get you to deliberately throw up? What would get you to do that? There's some pretty challenging stuff in the world. I've seen just all sorts of it over the years, and it gets really, really easy. What on earth would get a person to start doing that? Most of the time, we don't know the answer to that, most of the time. that stuff, and it becomes very challenging. And so, do you need occasionally some help from one of my medical colleagues? Absolutely, and I welcome it. I don't want to go to that when I don't have to. But, no, let's not gonna set that aside at all. I'd be in a terrible position if I set that aside. That wouldn't make any sense at all. And it wouldn't be for the betterment of the child either. It would certainly not be for their betterment, because there's certain things you just can't control. Another one, how about selective eating? How about kids that eat 2 foods? What are you gonna do with that? That's not good. No, Now, that's something that you can generally get past if you have enough patience. Like of a saint. For that, you see. I'm in the process of retiring, although if my wife were sitting here, she would probably say, so far, I haven't recognized that, which is probably true.
Sorry
But-
about that.
Sorry. It's all right. I will come here anytime.
I can handle an extinction, Bruce.
There you go. That's right. I used to have this, I bought it at a paint store, this big paint tarp, this plastic, clear plastic thing that you lay down, you know, paint a place, you know, or paint part of a room or house or something. So I got that for eating. And I kept it all those years, and then I'd have somebody come to the clinic and they weren't eating food, so then I would just move the chairs and stuff and spread the tarp out, see, and then food would go flying all over the place. And then when we were done, we'd just wrap the tarp back and wash it a little bit, walk the tarp back, put it back in the closet. And do it, and God knows how many times I pulled that tarp out, and did feeding sessions with kids over the years. Oh, geez, 50, 60, 70 times, I don't know how many times. Many times. And the kids would sit there and just not eating that. Some of the more verbal kids would be, no way, they'd say stuff like that, not eating that. I said, Dad, that's what we're doing. These are green beans. This is not broccoli. This is not broccoli with vinegar. Ooh, my grandmother used to like it. Ooh, cool. Leave the vinegar somewhere else. I didn't like that part. Anyway. This is green beans. This is not rocket science. This is not spinach. This is green beans. See? This is not lima beans. This is green beans. This is not difficult. I know you like ice cream. Your ticket to the ice cream is the green beans. And you don't know that yet, but you're about to experience that. You're about to experience that your ticket to the ice cream is the green beans. And you can fuss and scream and yell all you want. And I'm happy. I got the ice cream here for you. I'm happy to give it to you. See? And then the kids they'll take a little bit of the green beans, and then they'll gum it. They'll put it in their cheek. See? Or cheek it, not gum it. They'll cheek it like this. See? Then they take the ice cream, and you turn around. They spit out the green bean. Oh yeah. No. Next time I'm going to watch till you chew and swallow. Then you get the ice cream. Then the kids want to play a little game with you. See? They want to dunk the green beans in the ice cream, so they can't taste the green beans at all. Or, the modern day version of that is, cover them with ranch dressing and then you won't even know they're beans. Been there, see, some people are nodding. You know, you've been there or done that, or certainly known people who do this. No ranch dressing, sorry. No, we're not doing ranch dressing. We're going to do a tiny little bean, because you're going to experience what beans are. If you put ranch dressing on it, you don't even know they're beans. Anybody could do that. That doesn't teach you how to eat green beans, unless what you do is put ranch dressing on them the first couple times and then get rid of the ranch dressing. But that will be hard, because the youngsters are already used to it. They already see that if they play you enough, they can get the ranch dressing. See? No ranch dressing. Boy, Dr. McCready is a mean old guy. He is. He's a mean old guy. No, we're not doing the ranch dressing. Too hard to get rid of. Little tiny bit of bean. Take it to ice cream. Gradually a little bit more bean. And then we'll mix in some crackers and other stuff you like. But make no mistake about it. This is September, right? Hopefully it's till September. Yeah. And not terrible. You can't tell what month it is. You're too busy in life when you can't tell what month it is. Anyway, when we get past the green beans, we're going to something else. And 2 months from now, you're going to eat 4 things you never ate before. I'm not going to make them really difficult stuff. But guess what? Life is not about cheese crackers and macaroni and cheese. It's going to be about more than that. Starting today. And it's hard. Ladies and gentlemen, it's very hard. And here's what's even harder about it. Today, in most families, mom and dad both work. Most families today. So you got to work a difficult day. All the challenges that day might present. And then you gotta come home to food flying all over the place. And you're driving home thinking, oh, good, bless America, look what I gotta do tonight. I gotta fix the green beans tonight. So now, your spouse is there, maybe your significant other, and you're just going, what deal can I make her to take the green beans tonight instead of me? What trade can I go back and forth? Could you do the green beans? If I did this, would you do the green beans tonight? Been there, done that. Yeah. Oh, because you had a tough day. See, and it's tough. I grant you it's tough. But you can make believe the world is like you want it to be, or face the world the way it is. And if you face up to that and do it, and get through the nastiness, your life will be better. As sure as I am standing here, I have done it hundreds of times, hundreds and hundreds and hundreds of times. The tantrums and the stuff I have seen, I hope you will never see. There's 3 or 4 kids, young adults I'm working with right now, the behavior is so atrocious, I won't even tell my wife, and I'll tell her most everything. And I told her directly, I won't tell you this, you don't want to know. It's difficult. So difficult you could hardly imagine it. But we're going to make it, and we're going to get through it, and it's going to happen. It's going to happen, but it's very, very difficult because I'm going to stay with it. And it's hard. It's very, 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 very difficult. What do you find when kids who don't only want to eat 2 or 3 foods, they discover that French fries, other than those from McDonald's, aren't that bad? French fries are a long way from green beans, but I know kids that won't eat them unless they're from McDonald's. Guess what? The Wendy's French fries are not the end of the earth. We can do this, and then we can eventually get the beans and we'll be on with stuff. If we don't, you know what's going to happen. Your child is going to be severely nutritionally compromised by the time they're 8 or 9 or 10. You're going to have gastrointestinal, there's all kinds of stuff. Goodness knows what could happen. All kinds of terrible stuff. And here's the other throwback. Here's the behavioral part of it. Medical part of it's not good. The behavioral part is this. What did they learn? If I fuss long and hard and loud and nasty enough, what they ask me to do will go away. But, yeah, it will. Yeah, long and loud and hard and nasty enough, it'll go away. I am you. You want, and if it's, whether it's the green beans, or holding my hand, or sitting on the toilet, or putting shoes on other than Crocs.
Sorry.
No, it's really there. Every so often when I give an example like that, some of you will bust out laughing. Why? Because that's in your family, is it not? Yes. See, in Florida, we can get away with Crocs most of the year. Because you can get away without socks. See? And a lot of people use that as an excuse. You live in Florida, you can wear Crocs all year round. But you never learn to wear other shoes, then you go up north, and you're stuck, because all you can wear is Crocs. Yeah, no. No. Yeah. Whether it's the Crocs, or the beans, or the holding my hand, or the obsessing, or whatever it is, you be the person who's going to go away. I'm staying there till that stops. And it's hard. It's hard beyond all description. It's so hard. Hey, Jimmy. How you doing? It is hard. It's extraordinarily hard. But I've taught people to do it, and people can't do it. And you just have to keep your eye on the end and not where you are. I had a little fellow one time, his name was Jonathan. And Jonathan, every time Jonathan didn't want to do what I wanted him to do, he would tilt his, I can't even do that these days without wrenching my neck. He'd tilt his head like this, he'd say, Dr. McGreevy, you don't understand, I don't want to do that. Very bright little fellow too, very verbal guy. One day, I remember, I was so darn tempted one day to go, yes, I understand, but I didn't. Jonathan, I understand. The issue is not my level of understanding. This is what we're doing. But you don't understand. I don't want to do that. I understand, Jonathan. This is what we're doing. Put your name on a piece of paper. 4 hours and 10 minutes. 4 hours and 10 minutes later, he put it on a piece of paper. 4 hours and 10 minutes. And then once he got it on the paper, you know what he said to me? But I'm not doing it tomorrow. That's what he said to me. But I'm not doing it tomorrow. I said, Jonathan, I have some very interesting, or maybe not so interesting news for you. I will be here in the morning. I will be here. Yeah? Yeah?
Didn't do it the next day?
Huh? Took about 3 or 4 minutes. The following day, I didn't go, and he did it when he walked right in. No problem at all. All done. 2 or 3 days done. Over. Done. Yeah. What did the teacher say? If you don't write your name, I'm calling Dr. McGreevy. Yeah, okay. Well, that got it over the next couple of days. Yeah. After that, you didn't need to anymore. It was done. No, we're not doing that. I know how much you don't want to, but too bad. We're done.
Did you allow any escape or avoidance during those 4 hours? the
Nope.
first time?
You had to stay right there.
The whole thing, no
Whole
bathroom
time.
breaks?
Whole time. Oh, no, bathroom, of course, and drinks of water, sure. Reasonable things. Yeah. Yeah. And, but he didn't get his snack that morning, no. Now, Grant, now, listen, if he'd had diabetes or hypoglycemia or something where missing food would have been an issue, then certainly I would have allowed for that. Of course not. I'm not going to put somebody in jeopardy. Of course not. I wouldn't have allowed that to happen. But that was not the case. I asked him, checked. Blood sugar problems? No, none of that. Okay, well, we're just going to sit this, wait this out till we're done, you know? And a couple times, he would turn over to me and say smart aleck things like, you're really mean. One time he turned over and said, I'm going to see which one of us cracks first. I remember that. And my response to that was, nothing else. That's it.
You just point in.
Point. I don't need to say anything else. Why? He knows what to do.
Right.
It's crystal clear what he's supposed to do. He knows exactly what to do. He doesn't need anybody, he doesn't need any more instruction on what to do. He knows exactly what to do. So the more you talk with him, the more, see, I got him into a conversation. No. Right there. And then he just fussed it. He'd stick his tongue out at me. A couple of times he muttered some not so pleasant words under his breath that he thought maybe I didn't hear, but I did. Yeah. Words you don't particularly want a 5 or 6 year old boy to be saying. Anytime. 5, 6, 20, 25, you don't want ever to say that stuff. But he did. No. That's not going to get me to go away. I'm staying. And it's hard. Very, very hard. So, be persistent and be insistent. See? Now, when your child behaves well, does what you ask him to do, that's when you shower the positive stuff on. That's when it's like all about it. Oh, Jonathan, unbelievable, dude. You are the best. I mean, it's just like, oh, terrific. You know, that's stuff. Then you save your positives. And then you save lots of interaction. Then pretty soon you won't have to do that because the child will just do it, won't expect to look around. But if you find your child is looking around for your praise, why didn't I get it? You start doing it less often. See? Because you don't want your child going, let me see, if I do this, I got this. Then you're kind of on a road you don't want to be on either. A lot of people who don't understand behavior analysis or behavior modification say, well, I don't like all that rewards and punishment stuff. They're giving out too much stuff. Those people at Carl's place, they just give out too many tangible things. If we didn't, we couldn't get the bump start we need with a lot of kids. We wouldn't be able to. See? But the idea is, except when you're asking for your snacks, to eliminate, to get rid of that as much as you can, because you want people's behavior to be dependent not on the fact you get physical snacks. Mini M&M's it does not make a lifetime. No. It makes a very limited lifetime. Very limited experiences. No. Oh.
So did you praise a lot on
Yeah.
Yeah.
Yeah. He went had lunch, and he came back, and I said, Jonathan, I need you to do it one more time, and then he fussed again. And then the day after that, he fussed for about 2 minutes, and he did it. And then I asked him yet one more time, he did it immediately, and I said, John, that's it, dude, I can't believe it. So I walked him up to the principal's office and I said, this is the best kid in the whole school. Can you believe this? And he got a little principal's ribbon. And, yeah, sure. Then you powered on. But not till you get it. Well, that was kind of good. That was a little bit good. That's what I said. Almost, but not quite. But when you do it right after I tell you, then the ribbons, the balloons come. Sure. Not till then. Not till then. But if you get approximations, you get a little something. You get a little something. But you see, the difference is, this is not a skill that he couldn't do. If it was something he was physically having a heck of a time doing, then I would have given more reward earlier. If a lot of effort were involved, and he was out on struggle learning it. This is something he perfectly knew how to do. This was just, I'm not doing it. This is not struggling to do something. No. You know, if Joseph was struggling to do something, I wouldn't wait to give him a reward until it's absolutely perfect. No, I get it because he's struggling. He's trying to learn how to do it. Then you get some reward early on. Not when you already know how to do it. When you already know how to do it, you're not going to get that nice reward until you do it. And if I have to tell you 4 times, you're not getting it at all. Because then I will have taught you that you don't have to pay attention to Greepy the first 3 times, only the 4th. That isn't what I meant, is it? It's not. Children, a lot of times, pay more attention to what we do than what we say. They're too busy trying to convince us to do something else. See? Yeah. Well, just like today, if your daughter would have had probably a little more language, she'd have probably given us an elaborate explanation of why she didn't want to come in. Instead, it was mostly noise. A little bit of language, but mostly noise.
She was punching herself pretty good.
Well, I mean, there was that too. That was
No, but
that
I'm
too.
just saying,
There was that
I was
too.
gonna ask then, when I'm not doing her behavioral plan, they're not doing it at school, and I'm on my own with her, how do I not reinforce it? It's almost impossible. The seatbelt yesterday was a perfect example. We were driving.
Yes.
She undid her seatbelt, so at one point, I don't know, she was trying to get her doll, she started punching her head. I had to put her seatbelt on, so she was reinforced indirectly. But the safety thing versus,
How was she reinforced? How do you think? How do you think she was reinforced?
well, I stopped, I put on the seatbelt, she calmed down.
Well, you can't. There's certain
But
things
the
you
safety
just can't
thing
not
is
do
tough
that.
with the
You've got to go to
self-injury.
safety first.
And the safety, yeah. And it, out there, she did it, and I stopped, and it delayed her from coming in. She would have enjoyed that.
Yeah.
That's my
Well,
opinion.
sometimes with these kind of things, you're between a rock and a hard place. You have to protect the person, so you have to get the safety in there. And that may inadvertently reinforce it. But what you do is try to keep that to an absolute minimum. Now, you notice when I was getting her in, see, I wasn't talking to her about it, and she was not happy with me at all, and she never even met me. She never even met me. She didn't know who this guy was. See, never even met me. She was not happy with me at all.
She's confused.
Yeah, she was great. Who is this guy and what's he doing?
Pushing her along.
Yeah, and I saw you out there in the
Yeah.
parking lot, and I said, this poor woman's gonna take another 15 minutes to get in here. And so I said, well, let's, okay. So, but I was just going on, let's go. We're going, you know? And then she dropped down, I'd get her back up, going again. And then eventually, toward the very end, all I was doing was just tapping her on the back like this. And she was going. We're following mom, see? But if you're in a situation in public where that happens, and you have to grab a hold of her to keep her from hurting herself, then you just do that. That's the most important thing. She didn't hurt herself. Then, but don't talk to her. Don't in any way try to keep what might function as reward or reinforcement from happening. So don't be sympathetic. Da-da-da-da. You know what I'm saying?
Yeah.
Be sympathetic when you think she really is hurting, as you would, as any parent would. Don't be sympathetic then. Save it for later, and just hang on, and then get to where you're going, and know that you might have inadvertently reinforced it, but you're between a rock and a hard place. You don't have any choice. You got to protect her. You got to hold on to her. You got to keep her from hurting herself, and then you're between that rock and a hard place. But also something, if you haven't spent, my bet is you probably have, but if you haven't spent some time talking with these guys about that, do that.
Oh, we came here
Be-
because of it.
Be that.
And it's
Do
gone
that
down.
again, because that's
Yeah.
really important.
Yeah.
Oh, I've done this many times.
Yeah.
I've had to put helmets on people that I was pretty sure liked the helmet. See, that you're really between a rock. There's somebody
Yeah.
fisting themselves in the
Yeah.
head, and you put a helmet on, they seem to enjoy it. Well, what are you going to do? You're between a rock and a hard place. You can't let them do that and hurt themselves. So again, it's just like we were talking about before, there's certain circumstances where you just don't have all the control you'd like to have.
Right.
And so you take whatever control you can get, but you don't have it all the time. You have to live with what you can get.
She liked the gloves when she fit herself. She loved the gloves.
Yeah.
But how long do you do a behavioral plan with self-interest behavior before contemplating medication?
Boy, that's a heck of a question. The answer is that's as different, I'm not opting out of your question.
No, and I
because
know it's a hard
it's
one,
as
but I've
different-
got
it's as
neurologists
different-
on
it's as
me booking
different as
appointments and
individual
I keep
cases.
stalling them.
I know, but
Because
it's as different
my
as
back has
individual.
really reduced it, it hasn't eliminated it, so I can't tell the doctors it's gone. But I know as soon as I go back, they're gonna wanna medicate her, and I don't want to, but
I
I
tell you
just
what I
heard you
would do,
talk about
here's
it.
what I would do. This is what the boss and the clinical director are for. As I did get with these two guys, and I would ask that advice, because see, I can't, because I don't know your daughter. I just spent 5 minutes with her, and I don't know her at all. So I couldn't make that, and it's as individual. Those things are so individual, it's hard to make general statements about them because they're so individual. But get with them, talk through that, talk all the issues, and they'll give you a good heads up on that. They'll be able, they've done this before, and so they'll be able to help you with that decision. But it's not an easy one. And you know, you might make a tentative decision that you're not extremely comfortable with, but just remember this, and amidst all that it's a difficult decision. Try not to second guess yourself. Don't be your own worst enemy. You know, don't be too self-critical because it's hard. And anybody who hasn't been through that couldn't possibly understand it. And always remember that. So advice is cheap from people who have never been down that road. That is as cheap as it can be because they haven't been down that road. There's some things in life I'm fully convinced that if you haven't been down that road, you can't understand. You couldn't possibly understand what that meant. People can say they understand, but they're being nice, they're being pleasant, but they can't. And so be careful about advice from people who haven't been down that road. And will you be the only person or even a minority of people who have had to deal with medication related to self-injury? No. Thousands of people before you have had to make that same decision they never wanted to make. So you may not know very many of them or met any of them yet, but let me tell you, they're out there by the thousands. By the thousands. There's several thousand people in metropolitan Indianapolis alone. I mean, this is not such a rare phenomenon that very few people have experienced it. Lots of people have. And yet it's gut-wrenching. I've been there in hundreds and hundreds and hundreds of cases over the years. It's very, very difficult stuff. So ask these guys, and I think they'll be a great help to you. Now, I think my time's about up because you have other things on your agenda tonight. So,
Yeah, we kind of had to have a hard
Yeah, we do.
exit today because we only have a half hour
So-
before the next one. But let me just say one quick thing. just related. I know what everybody thinks, but with like the 4 hours of the extinction burst and stuff. I think sometimes you have to pick your battles. So because I know what I would be thinking. Everyone's like, suppose you're on your way out the door. You're on the way to the airport.
Yeah.
And the kid's not eating green beans. What do you do then? Would you say, don't even start? You know.
Well, if you
Maybe
don't
it's
think
don't
you're gonna
even
have the
offer
time to
green
follow
beans,
through,
follow
then don't give the direction at the
Exactly.
beginning. Just do it for them, and don't give the
Yeah.
direction at the beginning.
Safe, yeah. So sometimes.
But even if you do sometimes give the direction quickly, and then you realize you don't have the time, what you'd be better off doing is just caving in right away. And don't, because you're not built, just cave in right away. Say, I made a mistake, we're not doing it, I'll do it for you. And then just cave in right away. Because if you cave in 15 minutes into it, you've taught them to be more resistant to you, inadvertently, without intending. You've taught them to be more resistant. So you'd be better to cave in right away. Then, and know that no teaching is going to be perfect. You're not going to do this right every single time, sometimes you're just going to mess up and say, oh, I wish I hadn't said that, oh, it's too late now. Okay, cut your losses and go to the next time. Yeah. Sure.
See, he made it 4 hours and 10 minutes, but I bet he could have made it 5 hours. That's what you gotta do.
That might
So
be
that's
true.
what we have to. Okay, well, thank you very much, and there's food in the back there, right, Devin?
In the kitchen?
Yes, in the kitchen. So, and then we're starting again in about a half hour.
Sarah set up this lovely evening and was able to, we weren't sure if those of you who brought children needed food for your children too, so we upped our order to include your children at the end, feed them anything from the So feel free to head to the back.
No, you're fine. Yeah, I was so glad I was just when I looked at both, I was so glad
If I'm on sale, I can. If mine is really hard to get, I guess I'm just for the company. No, you're fine. And I'd be curious on this kind of thing.
Excuse me, I have to at least know your daughter's name. Coco. I did hear you say that.
John's actually from Canada, so I came for